Morning.
Good morning, folks. Thanks for being here today. My name is Jessica Wisniewski. I'm the Legislative and Campaigns Director at Citizen Action of New York, one of the founding organizations of Healthcare for All New York, which is a coalition of health advocate groups, over 150 organizations a part of that coalition. And we're joined with NYFAC, New Yorkers for Accessible Health Coverage, another coalition of groups of organizations concerned about the chronically ill. And we are coming together today with our supporting organizations on two budget priorities for Healthcare for All New York and NYFAC. There are two budget, some may say details, but that will directly impact very greatly very sick people in New York State. And so in this executive budget and the two House bills, we're dealing with implementing the Affordable Care Act here in New York State. And of course, the promise of the Affordable Care Act is that everybody gets more and more quality, affordable health insurance. And we want to make sure some of the details of the implementation do no harm to New Yorkers. So we're very concerned about the Family Health Plus program and how that transition happens from the current program on into the new health insurance exchange, and making sure all of those people who are currently on Family Health Plus or are eligible for Family Health Plus make the transition and no harm is meant to them. In fact, they get even better coverage and more affordable coverage. And then a second element for Healthcare for All New York and NYFAC is how we're dealing with our new insurance laws as we make the transition to the health insurance exchange. And there is a critical part of the transition that we want to make sure people who can go out of network to see the specialists, the doctors that they need, that can save their lives, get the care that they need and continue to not have to pay huge costs to see those out-of-network doctors. So we've got some experts with us here today, and a person whose family uses Family Health Plus to show just how important that program is to New Yorkers. So I want to start out by introducing Trilby DeYoung, who's the Senior Health Law Attorney at Empire Justice Center, to give us the details on what's happening with Family Health Plus in the budget.
Thank you. Hi, I am from Empire Justice Center, which is a statewide backup center for legal services in New York. And I'm here as a steering committee member of Healthcare for All New Yorkers and a founding member of Medicaid Matters New York. With regard to Family Health Plus, the governor's budget takes a number of very important steps required by the Affordable Care Act to implement federal health care reform here in New York, including an online application that will make it possible for New Yorkers to apply for a variety of insurance affordability programs: Medicaid, Child Health Plus, and advanced premium tax credits and cost-sharing reductions to help make private coverage in the exchange affordable. But the governor's budget also eliminates Family Health Plus, and we are very concerned that the families and individuals in Family Health Plus will not be able to get affordable health insurance coverage in the exchange, even with the federal health subsidies. Even with the federal subsidies, premiums for private coverage in the exchange are expected to be near $700 a year for families earning only 150% of federal poverty. That is going to put private coverage out of reach. In recognition of this, the governor does provide some assistance for parents already enrolled in Family Health Plus. He would help them with state dollars with premiums and cost sharing to make coverage in the exchange affordable. The Assembly would go further than that and extend premium assistance to all parents eligible for Family Health Plus. And the Assembly would also authorize New York to create a basic health program, which is a very important component of making coverage affordable for low-income families in New York. Unfortunately, HHS has said you can't create a basic health program until 2015. So we're here today asking that in the interim, assistance be provided with premiums for parents and single adults and childless couples up to 150% of federal poverty so that they can afford private coverage in the exchange. New York State stands to gain $2.5 billion in savings under the ACA. We think it is only right to set aside a modest amount of those savings to make sure that low-income working individuals and parents can afford health coverage. But now we'd like to hear from somebody about the value of Family Health Plus coverage today.
So Fredesvinda Vasquez, a member of Make the Road New York, will give her testimony in Spanish, then I'll translate it after. So.
Muy buenos días. Hola, mi nombre es Fredesvinda Vázquez, vivo en Bucio, de Brooklyn. Soy miembro de Marketing Ross. Yo vivo con mi hija Annie Aguilar y mi hijo y mi nieto de 9 años. Yo y mi nieto tenemos suerte porque tenemos Medicaid y seguro médico, pero Annie, mi hija, no tiene la misma suerte de tener el Medicaid, porque ella gana 1.300 pesos y una madre soltera, es una madre soltera y ella tiene Familia Plus, que es un seguro muy bueno y comprensivo. Yo soy una sobreviviente de cáncer del seno y no quiero que mi hija pase por lo que pasé yo. Al no tener el seguro médico ni Medicaid, me operaron y me mandaron una cuenta de $10.500. Y yo no tenía ni siquiera para comprarle una medicina. Y me estaban cobrando ese dinero. Entonces yo no quiero que mi hija pase por lo que pasé yo, que con cáncer del seno, y no podía comprar ni siquiera una pastilla para tomármela. Ese seguro médico es muy importante para ella, porque con ese seguro médico ella puede pagar los costos, ir al médico, y se resuelven todos sus problemas de la medicina. El seguro médico es muy importante porque sin un seguro médico nosotros no podemos sobrevivir. Somos familia pobre y necesitamos el seguro médico. Ese seguro médico de Familia Plus es muy importante para nosotros. Y nosotros queremos que se le dé toda la ayuda necesaria al seguro médico porque nosotros los pobres lo necesitamos. Gracias.
So, good morning. Good morning, my name is Fredesvinda Vasquez and I live in Bushwick, Brooklyn. I am an active member of Make the Road New York. I live with my daughter Annie Aguilar and her son, my grandson, who's 9 years old. My grandson and I are lucky to have Medicaid. My daughter Annie has Medicaid as well. My grandson and I are lucky to have Medicaid. My daughter Annie had Medicaid, but she works as a home health attendant, and since her income increased, she no longer qualifies for Medicaid. She earns $1,393 a month and is a single mother. Annie now has Family Health Plus, which is really good comprehensive insurance. I myself am a breast cancer survivor, and I am well aware of the importance of having health insurance. When I had cancer, I went to the hospital without insurance, and they sent me bills for over $1,000. Having just had surgery, and without insurance, I couldn't pay for the bills. I don't want my daughter to go through the same experience I went through of having breast cancer and not having health insurance to cover the costs. It is very important that my daughter can also go to regular doctor visits and primary care visits. With her income, without Family Health Plus, she cannot afford to buy private insurance because the costs are too high. Luckily, she has Family Health Plus that can cover the costs of her doctor visits, and she can get the care she needs. Without Family Health Plus, Annie would not have insurance and would not be able to go to the doctor or would have high medical bills like I did, and she cannot afford to pay that. Therefore, Family Health Plus is a program that is very important for families like mine. It's very good coverage, and I don't know what my daughter would do without this insurance. Thank you.
Thank you so much. So it's families that have Family Health Plus now that we're looking out for, and all those who are currently eligible but don't yet have Family Health Plus that are going to be required by the Affordable Care Act to get coverage in 2014. And those are the families we don't want paying a dime more for good quality coverage on the health insurance exchange. So like Shelby said, the governor took us through step one, the assembly got a little bit further, but there needs to be an overall fix to ensure everybody in the Family Health Plus eligibility population gets a good quality and affordable package when they're fully on board in the health insurance exchange. So the next priority for us at Healthcare for All New York and New Yorkers for Accessible Health Coverage has to do with folks who use out-of-network doctors and whether or not they're going to have to pay much, much more on the health insurance exchange. So I want to invite Heidi Siegfried from NIFAC to tell us the details.
Hi, so my name is Heidi Siegfried. I'm the Program Director of New Yorkers for Accessible Health Coverage, and we are a coalition of 53 voluntary health groups and allied groups who serve people with serious illness and disability. So this includes multiple sclerosis, includes cancer, it includes HIV, a lot of diseases that require, pretty important treatments. We are very concerned about the potential disappearance of a very important benefit for our members, and that is the ability to buy an out-of-network rider when you're buying coverage in the individual health insurance market. So people that have to buy coverage on their own can now pay quite a bit of money actually, but to get a rider so that they can see out-of-network doctors. And we've had this protection in place since 1996. It's in our law. The governor has repealed these sections of our insurance law, and not only will insurers not be required to offer this out-of-network coverage, they can cancel the existing policies of over 5,000 people who are using this coverage and are in treatments right now that are critical to their lives. We have an example of Jane from Brooklyn who attributes her survival to the ability to use out-of-network doctors and to access their expertise. And she is really fearful about the cancellation of her policy. She was diagnosed with a rare cancer, and I have to read it because it's metastatic leiomyosarcoma in 2001 when she was 44, and this actually has a very grim prognosis. It was expected that she might only live for 3 years. She was fortunate to have access to doctors both in-network and out-of-network, important cancer centers that specialize in very different kinds of treatment. And so she really needed to have both. So with the treatment that she got from the in-network doctor and the out-of-network doctor, she is now doing well 12 years after her first diagnosis. She pays over $5,000 a quarter for the coverage that she has, but it is really worth it to her. And she says that without the network benefit, she will be lost. And she begs, please don't take this option away. It's really crucial for people like her, people like HIV. There are HIV specialists that specialize also in very particular kinds of treatment, and they don't take any plans. So they really, the people that go to them are using their out-of-network coverage. President Obama promised when we passed the ACA, he said, folks, that's what he always says, folks, you'll be able to keep your coverage if you like it. And what we're seeing now is that the governor, by allowing the repeal of these important insurance protections, is really betraying that promise. These 5,000 people may very well start to receive notices canceling their policy next year, and they are just going to be in real trouble because they obviously are not going to be able to afford to pay directly for these treatments. And whether or not they can get the care they need, it's going to be seriously jeopardized.
Thank you, Heidi. I want to invite Mike Burgess from the American Cancer Society to make a statement.
I'm with the American Cancer Society Cancer Action Network, State Advocacy Director. Obviously, as Heidi has just said, access to all kinds of specialists and treatment is very significant for cancer patients. The American Cancer Society Cancer Action Network is committed to seeing that we continue to have this option be available for out-of-network coverage. We would like to believe that we would have networks that had adequate coverage. That would be the goal, but if they don't, then we need to preserve the option for people to get life-saving treatment if that's what's necessary by being able to go out of network. So we support continuing that.
Thanks. Did you want to say a few words? Okay. I'd like to invite Kate Breslin, who I think today is representing Medicaid Matters New York, one of her many hats, to give her statement.
I'm Kate Breslin with the Schuyler Center for Analysis and Advocacy, and on the steering committee of Medicaid Matters New York. Medicaid Matters New York is a coalition of more than 140 organizations specifically dedicated to focusing on the consumer perspective in Medicaid. And so I wanted to bring a couple of issues to the fore. We have been extremely concerned about the fast pace of transitioning vulnerable populations to Medicaid managed care. And we are happy to see that in the Assembly there's some attention to making sure that there's a thoughtful transition, particularly for vulnerable populations to transition into Medicaid managed care. And we also want to ensure that that we maintain and really enhance due process, and in particular, again, for vulnerable populations in Medicaid managed care. For a long time, we have been very focused on what's called charity care, or the indigent care pool, which is the funds that provide coverage for when uninsured people go to the hospital. And there's language this year in the governor's budget, and even stronger and better language this year, that makes sure that the indigent care pool funding actually goes to cover care for uninsured people, and requires better transparency and better reporting about how that money is spent. We're extremely supportive of that. And then we also wanted to flag a few concerns that we have in the Senate's budget proposal, which appear to try to scale back eligibility and benefits for low-income people. And in particular, there are changes in eligibility for pregnant women and children that concern us, and frankly shock and surprise us, that we are going to be meeting with legislators about, to make sure that low-income pregnant women and their children can maintain the coverage that they need to have good outcomes. And we also are concerned about proposals, again within the Senate budget, that would limit access to the very kinds of services that we know prevent more acute conditions later. So those are some of the issues that we're most concerned about.
Thanks, Kate. So I think overall, you know, as folks are entering the hearing room behind us to go through some final negotiations on these health issues in the New York State budget this year, we are very mindful of, you know, 5,000 people who can't see their out-of-network doctor in the future, or the 77,000 people who are going to be needing to go on the health insurance exchange but would have been able to get Family Health Plus. These may seem like small amounts of people in New York State, but they are deeply, deeply affected by the decisions that are being made in the room behind him. Assemblyman Gottfried, who did very well improving the Assembly One House bill in these matters, and then the New York State Senate, Senators Hannan, Senator Seward, the chairs of jurisdiction, to really look at the details of this health part of the budget and make wise decisions on behalf of consumers in New York. Thank you. All right. Oh, any questions? Do you have any questions?
Do you have any opinion on the single-payer New York health plan that was recently unveiled?
Sure. I mean, I think I can certainly speak for Citizen Action of New York and let others speak for their own organizations. We're entirely supportive of a single-payer healthcare system, but we think the priority now, because the ACA is here and now and present in our midst, we have to do a lot of very detailed transitioning onto the ACA, and we hope that, you know, Trilby mentioned the Basic Health Plan, and the Basic Health Plan was a great part of the Affordable Care Act that really gets us even closer to a single-payer system down the road. And so we are happy to see that Assemblyman Gottfried, in addition to the single-payer bill that he released, also in this budget implemented authorization for that Basic Health Plan in 2015. But right here today, we're most concerned that the people who have to make the leap from New York's current programs to the health insurance exchange in this next year make that leap wholly, and that their care that they receive is just as good as it was in the past, if not better, and as affordable. All right. Thanks, everybody. So I think we should go downstairs.